All right, good morning and welcome to another edition of Face to Face. This one's a hybrid edition. I'm Alex Lakowski, AVP of Communications. Since early December, the headlines have been grim. In the Wall Street Journal, how the U.S. is tightening the reins on federal student loans. In Newsweek, warning issued for student loan borrowers. And Bloomberg News, how the Trump administration is putting the squeeze on student borrowers. A big part of that squeeze is a change in the limits on student borrowing. Last summer's One Big Beautiful Bill Act eliminates the existing Grad Plus program for new students after July 1st. It also imposes annual limits on new borrowers, $50,000 a year for professional degree students, and $20,500 for all other graduate students. The lifetime limits are $200,000 and $100,000 respectively. Now, the controversy over the professional degree designation stems from the fact that the federal rules, which have not changed, categorize only a limited number of degrees as professional. The relevant degrees at UMB are MD, DDS, JD, and PharmD degrees. Others, like nursing, physical therapy, social work degrees, are not included on the professional list. Now, as you might imagine, nursing advocacy groups in particular were quick to respond. They argued that any policy that might dissuade potential nursing students will only exacerbate a serious and growing nursing shortage. We have a primary care crisis in this country, said Deborah Troutman, President and Chief Executive Officer of the American Association of Colleges of Nursing. The omission is not only harmful for nursing, the omission is not good for anyone who needs health care. The Department of Education defended its classification, saying the categories are merely an internal definition and have, quote, no bearing on whether a program is professional in nature or not. They argued that 95% of nursing students borrow below the new limit, and placing a cap on loans for graduate nursing programs will force colleges to reduce program costs and thereby reduce future student debt. So, how many students will be impacted by the new limits? Well, according to the Federal Reserve Bank of Philadelphia, which monitors such things, about 28% of graduate borrowers nationally would have exceeded the new limits in recent years. About 4 in 10 of those probably wouldn't qualify for private financing without a cosigner. There are also parts of the new federal rules that impact existing student borrowers who now hold more than $1.6 trillion in loans. Many of the existing repayment plans are being phased out and replaced by a new plan called WRAP, which includes income-driven payments of between 1 and 10% of a borrower's income. Also starting this year, most student loan forgiveness is taxable as federal income. And the government announced, but then decided on Friday to pause wage garnishments for borrowers in default. In a media interview in late November, Secretary of Education Linda McMahon explained that all of these actions are intended to reduce the cost of a college education and push students to enter careers with higher returns on investment or opt out of higher education entirely. She said, when you think about the fact that a university could just simply say, this is how much it costs to come and get this program, and then a student could borrow that amount, what incentive is there for colleges and universities to reduce their costs? She said, adding, I don't think everyone needs a 4-year college education. As for that return on investment, the Department of Education is also putting pressure on schools to ensure graduates are earning substantially more money than they would have without their degree. On January 12th, the Department of Education Committee approved another new rule requiring that all higher ed programs face an earnings premium test. When and if that rule gets final approval, programs whose graduates earn too little, 2 out of 3 years, would be cut off from federal student loans. Now, lots of people have questions about all this, so it's lucky we have with us a woman who seems, at least to me, to have all the answers. That's Patricia Scott up right there. She's AVP of Enrollment, Administration, and University Registrar. And beside her, of course, is today's host and our Provost and Executive Vice President, Dr. Roger Ward. Now, I want to remind everyone that this is a hybrid event, so there are many, many more people joining us remotely than the people who are in this room. So when the time comes, you will be able to ask your questions. If you're here in the campus center, be sure to step up to the microphone so that everyone at home or in their office watching can, or in any other way, joining remotely, can hear your question. And if you're in the virtual audience, please write your question in the Q&A area and let me know if you don't want to speak up or give your name. Now, please welcome Dr. Roger Ward.
Good morning. Thank you, as always, Alex, for a very spectacular setup. Sometimes I feel after Alex's introductions, we should just go straight to questions because he does such a comprehensive and thorough job setting up and describing the issue. Let me also say good morning to those of you who are physically present, and as Alex said, to those of you joining virtually as well. We are grateful that you have taken the time this morning to join us, again, whether in person or virtually, right after a long, hopefully restful holiday weekend, to be with us this early on a Tuesday morning. As Alex also said, I'm grateful to have the opportunity to chat, and it is going to be a conversation, and then we'll leave time for questions from the audience with Patricia Scott, who is our resident expert on all things financial aid. And I don't think that any institution in the system, quite frankly, has someone with the depth of experience and knowledge that Patricia had. So we're very fortunate and grateful to have her here at UMB to talk us through and lead us through these changes. I want to start with a point that Alex made, because it's the one that sort of like popped in the news when the bill was passed, and it had to do with who's considered professional and who's considered not professional, if you will. And as Alex said in his setup, the law hasn't changed. So with that, Patricia, what has changed? What is the law currently as it relates to who's classified as professional students, especially as it relates to the programs we have here? And if the law hasn't changed, what has changed to put the focus on this classification of professional versus graduate students?
Thank you, Dr. Ward, for that question. And thank you everyone here in person and those who are watching virtually. It's very interesting to me that I think only financial aid professionals ever look at the regulations. The professional programs that were listed and that are currently listed in the regulation for UMB have only been the MD program, the DDS program, the JD program, and the PharmD program. And that's only for what type of loan or the amount of loan are you eligible to receive. It's not saying that nursing, social work, DPT, physical therapy, or the PA program are not professional programs. They are. The way that the MD program, DDS program, and PharmD program were ever able to borrow more money was because way back in the day, in the 80s, there was a program offered by Health and Human Services called the Health Education Assistance Loan. When that loan sunset, the conversation between HHS and the Department of Education was, what type of borrowing are we going to allow for these programs that are not able to borrow from the HEAL program? That conversation said, if a school has an MD student or DDS student or PharmD student, in our case, who had a current HEAL loan, they would then be able to borrow more money under the unsubsidized Stafford loan. So for the longest time on this campus, we did have DDS students and MD students who, at the time that the HEAL program sunset, we have borrowers in that program. So those programs were able to borrow more than $20,500. In fact, they were able to borrow $40,500. The PharmD program here did not have any current HEAL borrowers, so their borrowing amount remained at $20,500. I think what is really happening is the fact that the Graduate Plus loan is going to sunset on July 1st, 2026. And that is having people to scramble. What we're currently doing in the Central Financial Aid Office is we're pulling the numbers to find out how many of our DNP students would be impacted, how many of our PA students, and how many of our physical therapy students would be impacted, because they will still be able to borrow $20,500. They just will not be able to enhance that borrowing with the Graduate Plus loan program.
Okay, so there's a lot to unpack there, and I'm sure some of it we'll get to with questions. But I do want to get to what's changing come July 1st, 2026, as it relates to the loan limits by programs and what have you, and how that is feeding into this conversation about what professional students are allowed those classified as professionals are allowed to borrow, plus what the other students and our other programs here are allowed to borrow. So what exactly is happening come July 1st, 2026, and how is it impacting on the programs we have here?
Well, currently enrolled students with an eligible federal loan right now, nothing happens to them. Medical, dental, everybody, nothing happens to them as long as they stay in the same program and they're on time to completion. So if you are currently enrolled here at UNB and you received a financial aid offer that you accepted, and you accepted an unsubsidized loan, and your program limit was $20,500, that's going to be the same for 26, 27, 27, 28. If you're in a 4-year program, 28, 29. If you are currently enrolled and you don't have a loan, and you will be enrolled in the same program for 26, 27, you would then come under the new eligibility for loans. What does that mean? That means that we're going to have persons in the MD, DDS, PharmD, and JD program that will be under the legacy provision, and we will have persons in those programs that will be under the new loan limits, meaning medicine, dentistry, law, and PharmD. Those students will now be eligible to borrow $50,000 in the unsubsidized Stafford loan, but no Graduate Plus. For our nursing students, our PA students, and our physical therapy students, they will be eligible, new students and new borrowers will be eligible for $20,500 and no Graduate Plus.
Okay. So what I'm taking away from the conversation, and certainly what I gleaned from our time together in preparing for this session, is that a lot of this is going to be dependent on the individual, the student themselves, their current level of borrowing, if they're borrowing at all. And so we have to keep that in mind. When we have these general rules and guidelines, a lot of it is going to be dependent on the individual circumstances. So for those students who cannot or need to borrow more beyond in order to finance their education with these limits, what options are available to them to be able to cover and borrow to meet the full cost of their education?
For the 26-27 academic year, we are currently looking at lenders who are in the private arena. And looking at lenders in the private arena, it's very important for us to find lenders who are not going to fleece our students with very high interest rates. Also, lenders that are willing to lend without students having to have a co-borrower. But we currently have not as large of a private alternative loan portfolio, but we currently have students who were eligible to borrow federal loans who have said, I've been responsible with my credit. I know what my credit score is. Why would I borrow a federal loan at a 9% interest rate when I could get a private loan at a 5% interest rate? We have a conversation with them on an individual basis, and that's their choice. And it's always been the choice of a student to take a federal Grad Plus or seek other types of opportunities to finance their education. I really believe that this is going to make our students really more responsible borrowers, because if it's really easy for you to get something, you get it. There's nothing that you have to repay while you're enrolled in school. And then it's almost a situation where I'll deal with this after I graduate. This is now going to have them to start to think about other than my direct expenses, things beyond tuition and mandatory fees. What else do I need to borrow for? Do I need to live at a very expensive apartment? Or do I say, I'm going to bite the bullet, I'm going to be a student, and I'm going to have a roommate to reduce my cost?
Well, of course, this is something that we have grappled with for a long time. And going back several years now, we had in the financial aid office financial wellness counselors to talk our students through responsible borrowing. Of course, our student demographic, we have undergraduate students here, so I want to recognize that we also have undergraduate students here, even though we don't have first-time undergraduate students here. We do have some undergraduate students, upper class students, primarily in our school of nursing. And so we've always had financial wellness counseling to make sure that students are borrowing responsibly. But the demographics of our students are different. Many of them are working, many of them have families, and so on. And so, whereas on the traditional campuses, it might be prudent and responsible to say to students, don't overborrow, be responsible in your borrowing. I think our history has demonstrated that our students, because of the demographic, adults working with families and so on, tend to borrow responsibly. I know you are plugged into, we're not the only state, the only institution obviously grappling with this. How some states, I was reading recently that Connecticut, for example, as a state, is looking to put programs in place to sort of like fill the breach, if you will, that is created by these new borrowing limits and guidelines. What are you hearing from your colleagues around the country about how, whether as an institution or as a state, they're planning to grapple with these issues?
It really depends on if it's a state school or a private school. The privates are meeting just as we're meeting with the lenders within the alternative loan programs to see what they can put together for them. And they're looking at risk sharing models. Well, they have the money to put up to do a risk sharing model. And I'm not sure if what's happening here in the state of Maryland, that's something that we really want to venture into. Some of the public schools are looking to see, do we really start or change our focus and have admission be primarily that for in-state students? Because if the tuition is lower with a scholarship and possibly the unsubsidized Stafford loan, the student may not really have to look at the private market. But our concern within the central office is for our non-resident students. Our non-resident students, even if we give them a very sizable scholarship, after the unsubsidized Stafford loan, they really have to, in some cases, borrow just to cover their direct costs. Again, our in-state students, there are state scholarships and programs that they could be eligible for that would help bridge that gap as well. But again, that's something I think as a campus we need to really think about in terms of, do we have funds that we could dedicate to students to help bridge that gap? And again, I know the legislative session is happening now. Is this going to be a topic? It not only impacts UMB, I'm sure UB is having the same conversation. I'm sure other schools within the system are having this same conversation, especially when you're looking at, let's say, a College Park and MBA program that's very expensive as well.
So you talked earlier about the impact for students who are currently here and what that impact might be. And it's not as harsh, if you will, for those students currently enrolled as it would be for students who will enroll in the fall. And so to the extent that we have in the audience here and online admissions people and enrollment management people here at UMB, how should those individuals, those professionals in admissions and enrollment management be counseling students now that whose application they're reviewing and who they're in the process of admitting to our programs here at the at the university? How should those students be counseled with their families to think about financial aid?
First, I would say have them to contact the Central Financial Aid Office. I don't expect admissions professionals to also be financial aid professionals. And the very important thing for us as a campus is to have the same message and the same voice. And that message has to come from those of us who are receiving the information in real time. I know that there are other places out there that are developing their answers or their interpretation of what's coming from federal student aid and the Department of Education. But my team, we have federal student aid IDs. So whatever federal student aid pushes out, we get it. But also as a campus, we have the good fortune that our budget allows us to be members of the National Association of Student Financial Aid Administrators. And through my working relationship with them, we do get hot off the press. This is what this actually means, and this is how this could impact you. So if you happen to be an admissions office and you have an admitted students day, please reach out to us to have us to come and talk finance their education. Financial aid has always had a priority filing date of March 1st. People really don't think about that, but for 26-27, it's going to be very important for them to complete their FAFSA by March 1st so that we have other opportunities to help them.
All right, let's turn to loan forgiveness and loan repayment. Alex mentioned RAP. What is that? Repayment Assistance Program. What exactly is that? What is changing with that? And what pressures, if any, benefits there might be to the changes in that program? How might that impact our borrowers and eventual graduates from our programs here?
So first, it's going to be important to know that students who are graduating May 14th, 2026, they would still be eligible for the current loan repayment programs, whether it's the standard, graduated, extended, or the current income-driven repayment plans. They're calling new borrowers, which would be borrowers who would have a loan after July 1st, 2026. Those borrowers will be eligible for the standard repayment, which now gives you the opportunity to sign up for 10, 15, or 25 years. Of course, it's standard. Whatever you sign up for, your repayment is going to be the same every month. Or the repayment assistance plan, now known as RAP, where your monthly payment is a minimum payment of $10. Your monthly payment is calculated at 1 to 10% of your adjusted gross income. So your monthly repayment for this plan also takes into consideration if you have a spouse or if you have dependents. But the tricky part of RAP is there's no cap on the monthly payment. So if they do the percentage of your income and that monthly payment under RAP is higher than the standard payment, you're going to pay more under that plan. It's something that we are trying to see how they're actually going to write this and how they're going to administer it. And again, as we hear and learn more, we'll be able to work with students who are graduating who would be eligible for the RAP program so that they make the right decision for repayment.
What is the current state of loan forgiveness now and after July 1st?
I don't know what's going to happen after July 1st, but as of today, public service loan forgiveness is still an option for borrowers.
And TBD on after July 1st?
Yes.
Okay. I know we have a lot of questions, and Alex, I'm sure folks are jumping at the bit. But maybe we could start with folks in the room. And if there are any questions, if not, Alex, we could go online.
We're just going to turn the mic on here. Go ahead, sir.
Good morning. I'm David Bunnell from School of Graduate Studies. First of all, thank you for this opportunity in a forum, and I appreciate the university's embrace of what happens if this moves forward. And there was an important word in that sentence that's doing a lot of work right now is if. And I'm a PA, I'm involved with our professional association. So of course we live on the advocacy side. And we've been following this story closely. And I can say that as the rulemaking for this went along, it was all okay until it wasn't at the last second and put us in this position. However, notice that this was the rulemaking and they have not opened up the comments in that section. While I understand you're embracing how to support the community if this happens, can you talk a little bit about the role of advocacy when the comment for rulemaking to attempt to stop these things?
So let me just see if I could just add to that. Patricia, from your perspective, in conversations with your colleagues, we're talking about this as a fait accompli. Is it a fait accompli? Where are we in the rulemaking process? I know there's been a lot of conversations about the comments period and whether it's open or not, or whether this is done for all intents and purposes. Could you bring any clarity to that?
This is the first time that I can remember, and I've done this for quite some time, where at the end of each rulemaking, consensus was met. So when consensus is met, the Department of Education now just takes the rules and provides guidance to financial aid offices as to how to implement the rules. That's not to say that a comment period will not open, but the likelihood of something changing as a result of consensus, I can't say that advocacy is not going to change what recently happened in all three of the rulemakings. With the RAP and standard repayments and them getting rid of all of the income-driven repayment plans, consensus. With the RISE negotiated rulemaking, consensus. And with the HEAD, consensus. We're in a different era now. And that's why I want us to start thinking about how can we best support our current students, our incoming students, knowing that the options that we had in the past don't seem to be available to us.
So Patricia, could you talk a little bit more on Kevin Kelly, who is our Chief Government Relations Officer? I'm giving you a heads up. I'm going to put you on the spot for a minute to just talk about, in your role, what kind of advocacy we've been doing as an institution with our congressional delegation. But Patricia, at your level and with your colleagues, what type of advocacy have your financial aid officers and people in your role have been engaged in?
We've been providing data to show with these changes how our students will be impacted. And we've taken that role again because some people attended in person, some attended virtually, and we were texting, we were putting ourselves on mute, those of us who were virtually, and we were saying, have you ever seen this? Have you seen that? And when we saw in some of the negotiations, people from different areas who were invited to be a part of the negotiations being shut down. And also when we noticed that this was the first time in history that none of the negotiators were practicing or retired financial aid administrators, we knew that this bill was a done deal. So we had to say to ourselves, how do we do what our passion is, helping students to finance their education, knowing that our hands are tied because this is something that was signed, went to rulemaking, consensus is met, and now we're sitting here waiting to see how do we implement these rules.
Kevin, anything to add?
I will say,
Kevin, could you please go up to the microphone at the, sorry. Just looking out for our, what is it now? 226 people at home.
morning. So I totally echo what Patricia stated. I will say that all of the national associations, not only in terms of the colleges and universities writ large, but the associations that specifically represent social workers, nursing profession, and others have been very, very vocal and very instrumental in terms of trying to get this issue up to Congress's attention. Have not seen a lot of movement in Congress to try to intercede. There was actually a bill that was put out in December to try to eliminate some of the rules in the Big Beautiful Bill. That has not moved. It only has about 45 sponsors right now, primarily Democratic. And I think at this point, that's a potential vehicle. And in terms of, going forward, we will continue as a university. We brought this up to our congressional delegation as a concern. They hear it, but I think there is a recognition that this bill passed in July and how Congress is now structured. And so they're going to let this process run through. I think there'll be some potential down the road, maybe to draw back some of these provisions if there's some sort of changeover in a future congressional session. But for right now, I think the best that we're going to do is continue to advocate for our position and see what happens.
And since you have the mic, Kevin, and I know, Alex, I'm coming to you because I know they're virtual questions. You heard what Connecticut is doing. And I'm not going to ask you, tell us what Maryland is going to do because you don't have that power. But how do you assess the Connecticut plan? And could you talk about what that plan is and how you see that plan and what we might learn from it here in Maryland?
The Connecticut plan, because she's a little bit worse than I am on this. But I think to your point, though, there could be a movement within the General Assembly about taking a look at this issue. We've brought this issue up to some of the key leaders. Actually, when Dr. Gerald and Dr. Perman and President Pines appeared in front of the Budget and Taxation Committee in December to talk about the impact of federal research funding as well as the other impacts. This was brought up in terms of graduate programs. So there's a recognition within the General Assembly that this is going to be potentially an issue. And so there is the potential that something could happen on that. Right now, I haven't seen anything just yet, but we're early on in session.
Thanks, Kevin. Patricia, could you just say a quick word about what Connecticut is doing? Then we get to our next question.
So they're looking at a private initiative for their students. And it's looking at providing students with some type of relief directly from the state. And again, as Kevin stated, we are early in the session, but with our budget constraints, I don't know if as a state that's something that I would think it's something that we want to take on, but I'm not sure that the members, well, people who live in Maryland who are not advocates of higher education would think that that was something that was important for us to do at this time.
Alex?
All right, as you might imagine, we have a long queue of questioners from our remote audience. Let's start off with Sarah Hall-Matson. Sarah, are you still there? Go ahead and unmute yourself.
Yes. So I am a dual degree student, and part of what that requires is that I will take a leave of absence from one program to go complete the other program. And I was just wondering what that would look like in terms of any of the loan policies.
So currently, we're looking at the regulation on students who are in dual degree programs. And we're looking at that and we're hoping that we will get real guidance to come out of the regulations. If your program is structured as such, and if both programs have the correct memorandum of understanding, then you would not be considered to be on a leave of absence. It would be the way your program works. And as long as we can put all of that in place, let's say, for example, you start, and I'm going to purposely use a program that will be eligible for the $50,000 and have that student to be in a program that's eligible for $20,500. When that happens and we have the correct documents in place, when you leave the program that's eligible for the $50,000, because it's structured that way for you to then, for the next academic year, go into the program where your eligibility would be less, then we would have the ability to allow you to come back and not have your eligibility for the $50,000 to be impacted. And that's because we have to have it listed as such that you are not changing programs, but you're in the same program of study.
So basically, for dual degree programs, we have to be very intentional and thoughtful in structuring these programs in a way where they're not seen as separate programs that students on their own decides, I'm going to take the 2 years here and then switch over to another program, which times have happened. So that's something to take away from that. Very, very good question. Alex?
Right. An anonymous attendee writes, does UMB intend to lower cost of living facilities does UMB intend to open lower cost of living facilities or lower any of their expenses if we're implying that students need to tighten their own wallets or become more responsible with their own budgeting? If students are being told to tighten their spending, what would encourage students to attend school if there's no reduction of costs at UMB?
So that's a fair question, and it's certainly one that the Secretary of Education offered as a reason for modifying and setting these loan limits. One, to get students to think about what responsible borrowing looks like, but also to push in Howard's institutions to look at lowering cost of education and take some of the cost out. And so it's a very, very reasonable question. I have the benefit of having a couple of deans here in the audience, so I'm going to put at least one of them on the spot and maybe another. And so, Dean from the School of Nursing, can you speak to some of the steps that you as Dean and the School of Nursing are currently taking, even before this issue came up, to make nursing education affordable to students, whether at the BSN, MSN, or DNP level?
Thank you very much, and I thank both of you for this presentation. In the School of Nursing, we've been very strategic in terms of making sure we offer scholarships to students at all levels. And so that's one way that we can help. We know that students do still struggle with learning. And so we also offer emergency support funding to students to help them. And then the final thing I wanted to say was, I think we need to, seek even more opportunities for scholarship, to really think about philanthropy and what's the role for philanthropy as we are going through this current phase with increase. But I think the one point I would want to leave you with as a student is just a reminder that public education is affordable. And so when you look at places like University of Maryland as a public institution, compared to private institutions, our tuition is very affordable. And so I think students will have to really think about, as they're choosing where they want to select to receive their education, looking at the tuition overall. But public education remains, I think, affordable.
Thank you, Dean Obulu. And that point about affordability cannot be overstated. It is affordable, and furthermore, it is an investment that the data shows pays off over time relative to other investments. But that notwithstanding, we do have an obligation as an institution, as the dean just articulated, to do everything we can to make our programs affordable and accessible. Because of what we care about in terms of improving the human condition, we want as many students from as many backgrounds as possible accessing our programs, and we don't want the cost of attendance to be a barrier to that. Dean Wong, I don't want to leave you out. I know you're here in the audience for the School of Graduate Studies. Do you have anything to add to what your colleague from nursing said?
Thank you. I'm Kenneth Wong. I serve as the Dean for the School of Graduate Studies. My colleague, Dean Ogbalu, said most of the, I think, the points that I would want to make. But what I would add is that high quality education, particularly in the health sciences, is expensive. To get quality faculty, to have them spend their time here, to have the kind of facilities that we need to do good quality education, to put healthcare providers out in the community who are working on the front lines and providing healthcare. To do that well is not something that we can cut a lot of costs on, because we know from experience, when you cut costs on that and you put unqualified providers out there and you have people out who are not well trained, society suffers as a result. So I want us to keep focused on that yes, some things in higher education are expensive, but we're very conscious about costs. And we do that because we know that the people that we send out into the community to provide healthcare, particularly, they have to be really excellent. And there is no way we can compromise on that and benefit society.
Yeah. And before we get to the next question, Patricia, thank you, Dean. How do we use grants and other types of funding here to take some of that borrowing pressure off of students?
We have everyone who's interested in any type of grant aid to complete the free application for federal student aid, and that does the needs assessment. And we use that needs assessment to determine who is eligible for the need-based funds that come through the campus that the Central Financial Aid Office manages. We also say to students, if you receive, in addition to those funds, if you receive funds because you are a Maryland resident, you get a senatorial, a delegate scholarship, or some funding from there, we don't do a bait and switch. We allow you to keep those funds and we reduce the most expensive loan that you have. So what we try to do is to help those who really need help. And that's another reason why it's important for students to reach out to us. We don't know what your need is. We get the free application. It may tell one story, but that may not be what your current situation is now. And I would like to publicly thank those student affairs deans and even those deans who reach out to us when a student comes to them and says, I have this problem. I think I need to drop out. I think once we make that connection, we're able to work with that student and find a solution for what they thought was a financial issue for them.
Thank you. Alex.
All right, I want to encourage anyone here in the room, if you have a question, there's still time, just come up to the microphone and you'll be able to ask. In the meantime, we do have an anonymous attendee who writes about something, Patricia, you've talked about. Does UMB plan to partner with private banks or other loan companies? And if so, what financial incentive would UMB receive for selling private loans to students? Well, in fairness, you didn't talk about that last part, but about private banks. Can you talk about that?
So before she talks about that, let me address the incentives that we get from selling loans to lenders. Over 15 years ago, now that became an issue in the financial aid world, and regulations were adopted, laws passed, and people persecuted, quite frankly, for having those types of arrangements where institutions were steering student borrowers and their parents as particular lenders. That was never the practice here at UMB, and we don't intend ever for that to be the practice here at UMB. So to the extent that Patricia and her team, they are exploring opportunities for how to support our students given these loan limit challenges, and looking at private lenders and private industry, you could rest assured it would be compliant, fully compliant with rules, regulations around the way universities engage with the private lending market.
Thank you for that. And plus, I've signed a code of conduct, which means we will not do any of that. The conversation that we've been having with the many private lenders are, this is our loan portfolio. This is our current federal default rate, which means prior to the pandemic and even through the pandemic, we're at 0.4%, which means most of our graduates or even people who withdraw do repay their loans. With that being said, we're asking lenders, we have a medical school. I know you lend to other medical schools nationwide. Can there be an interest rate or a loan program tailored for medical school students? We have a School of Social Work. So we've talked about all of the programs that we have, and we've even talked about the degree completion undergraduate programs we have, such as the BSN program and the Bachelor's of Science in Dental Hygiene. And we're doing so because there are also changes in the Parent Plus loan program. So we need to make certain that not just because of the elimination of the Graduate Plus program, but also due to the changes in the Parent Plus loan program in the private market, we want to find lenders that are going to be beneficial to our students. The other quick thing that we will not do is we will not have a lender list. A lender list is something that a lot of my colleagues use. They say that it's very useful, and it could be very useful. But UMB being a primarily graduate professional school, but also a degree completion school, we may get students who have already vetted a lender in a previous educational experience. And to make repayment easier for that student, if you got loans at XYZ Bank, if XYZ Bank was not on our list, you may think that you cannot continue with XYZ Bank. So if you come and you already have loans or history with another lender and you need private loans for your education here, we will complete that loan with that current bank so that when you go into repayment, all of your private loans are with that same lender.
Go ahead, Jordana, you have a question?
Good morning. My name is Jordana Sinieri, and I'm Assistant Dean for Marketing and Communications in the School of Nursing. Thank you so much. This has been extremely helpful. I have a clarification question first, which is regarding the caps for the student loans, because I've heard some conflicting information. Does that include undergraduate education as well, or is it simply graduate level education? And then my second question is about our ability to continue to successfully recruit students, and do you think that these changes and challenges might impact that?
So the question about the loan cap, if you're under the old provision, so our current students would still only be eligible under the federal direct unsubsidized Stafford loan for $138,500. And that's undergraduate and graduate borrowing. For new students under the new provision, that $100,000 cap is only graduate loans. It does not include any loans that they may have had from a prior undergraduate experience. And is there going to be an impact? I'm not sure. We're going to have to go through this as partners so that the impact is not going to be as devastating as it was planned to be. So I think we as an institution working together, we're going to control what that narrative is. And I am so thinking that this is going to bring us the best and the brightest for UMB, because these are going to be the students who are going to seek out assistance. They're not going to do this alone. And then when they graduate, they're going to be very happy. They're going to have less loan debt. And then your alumni office is going to be happy because when they reach out to them for donations, they will now have those funds that they can contribute back.
And as it relates to your question, related to our ability to attract and recruit students here, as an institution and certainly as schools at the institution, we have to be able to articulate, and it's going to become more important that we are able to do so, articulate that the investment that a student is making in their education is going to have a significant return. The data in the marketplace writ large supports that, a college graduate tends to do better economically than a non-college graduate. And certainly given that we're the health and human services professions here, we could demonstrate with data that our students, regardless of how our programs are priced, and we're doing everything we can, of course, to remain affordable, that our students graduate. We did a study about 10 years ago now, looking at affordability, and the results show that our students here, again, across all the programs, were able to graduate and pay off their debt within 10 years using 10% of their discretionary income, which was the standard that was used, I think, what Gates Foundation or someone else that had established that measure. And across all our programs, we were able to do that. And so we remain affordable, but as we are trying to recruit students who may have heard about these challenges and will no doubt have heard about these challenges and would hear the narrative from some saying that not everyone needs a 4-year degree to, to be successful in society. That is true, but those with a degree tend to be more successful than those without. The data is pretty clear on that. I don't mind also saying that it's always interesting to me that the people with that narrative about not that a 4-year college degree isn't affordable, a professional degree isn't necessary. Those individuals all themselves have 4-year degrees and professional degrees, and they continue to send their children and grandchildren to college to get these very same degrees. And so, as I like to say, don't fall for the okey doke. Individuals and families need to think about what they want for their children, for their lives, and so on, and make a decision that's in their own best interest, relying on what the data shows and support. But I think as an institution, and certainly as programs, we do have to be by the students when they come to our institute, because it's a lot.
Okay, let's hear now from Sandra Cazada from the School of Medicine. Sandra, are you there?
Oh, hi. Yes. Good morning, everyone. Hi, Patricia. I think Sarah already asked very well the question about the dual degree sort of conundrum, and I was also similarly thinking about those students who take a leave of absence, not in the context of a dual degree, but potentially maybe they have a medical reason for why they need to step out a year, for example, and take a leave, and how that might potentially impact their current eligibility for federal funding.
I know we use the term leave of absence, and on the academic side, a leave of absence can be a semester or a year, but in the financial aid world, a leave of absence is only 180 days. So after a student has been out for more than 180 days, that student is considered withdrawn from the program, and that's because their loans have to begin the grace period to go into repayment. That question is one thing that we are waiting for guidance on. We need to find out if a student was here in an eligible program receiving loans and for whatever reason had to be out of the program for more than 180 days. When they come back, they're coming back to the same program. If they are currently enrolled 25, 26, they take time off, they come back. Can we still apply the legacy provision, or does that student now become a part of what the new regulations are? I know that's very important to the School of Medicine, and as soon as we get guidance, we will share that information with you.
All right, we've talked about the idea that those with professional degrees tend to have higher earnings, but not everyone, as you know, goes into these different professions that we teach here with the idea of the earning potential. It's more than that. It's about service. With that in mind, we have an anonymous attendee who writes, can you please speak more about the minimum earning requirements for graduate programs, specifically with respect to social work? Have specific details about what those requirements will be been released?
No, they have, for any of the programs, the earning requirements have not been released. I will share that this rule is expanding on the current financial value transparency and gainful employment regulations that we've all been accustomed to reporting on. When it was just gainful employment, they were only looking at certificate programs, but most recently with the financial value transparency, all institutions were required to go back and upload into the federal system the loan debt of all graduates, regardless of if they were in a certificate program or not. We will know by October 1st, under the financial value transparency, if our current programs are affordable. And once that information is publicized, then when we start coming under the new regulations, which actually are going to be 2030, that would the 2031 academic year would be the first time that all schools would see if they have programs that are not considered of value.
Probably have time for one more question. Let me bring in Isabel May. Isabel, you still there? You've been waiting a little bit.
I am. Hi, can you all hear me?
Yes.
Great. Patricia, thank you so much for this really, gosh, so much information, and it's really helpful because it's a little bit hard if you're not a financial aid expert to kind of sift through it. My question kind of adds to the question that David from the PA program asked earlier. And I'm wondering, what suggestions do you have for students, for faculty, for staff, for all of us to advocate on behalf of students with the goal to ensure a path for affordable graduate professional education? And Provost Ward mentioned the professional organizations earlier, and I'm sure that many of my colleagues, hopefully some of our students, are aware of those. But what can we do to support you? I mean, you gave a fairly bleak and probably realistic sort of assessment of the current situation, and I really appreciate that. Even in light of that, what can we do? Because I think many of us really feel we have voices, we have stories to tell. What can we do?
If the comment period opens, I would suggest that individuals write as individuals and not as persons affiliated with UMB. UMB has one OPE ID number, which means that if UMB decides to draft and write something during the comment period, it needs to be an institutional comment. What we don't want to happen is we don't want to look like we're not one university. So I strongly ask, again, that if you have the desire to do so, you do so as an individual, but let the comment come directly from the campus. And the reason I say that is I know all of the national associations, they have shared that with their members as well. They've said, if you want to write, you can write as an individual, but for that organization speaks for its members, and so they will enter the comment. And I'm sorry if it seems bleak, but in the world of financial aid, whatever the regulations tell us to do, we just have to do it. So you find people who work in the financial aid world, we're so passionate about helping individuals meet their goal, but we are always ready for that shoe to drop that says, you were doing this today, here's a new regulation, this is what you have to do tomorrow. So we're kind of the ones that roll with the punches with a smile on our face, and we know that the work that we do does impact our students. It impacts the entire university, and that's what we're striving to do.
And Isabel, thanks for the great question. I'll just end by saying, in terms of what each of us could do to advocate, we work in the academy. All of us, most of us have an undergrad degree, grad degrees, and so on. We know the value of education, and we have to arm ourselves with the data and the facts so that we could push back against the narrative that one higher education is way too expensive. And in our case, public higher education, as the Dean Obalu mentioned, that is not the case. In fact, we're very affordable. And two, there is a return, a significant return on investment for pursuing higher education. And we have to be prepared to make that argument relentlessly. The opposite narrative is being pushed, and there isn't enough of a pushback at every level, from us individually, from our professional associations, although they have stepped up to the plate, and certainly from our congressional or people in Congress. We have to keep talking confidently and armed with the data and information to push back against a lot of the false narrative, even as we continue to work hard to make our programs accessible and affordable.
Right, with those words, we're concluded. This event will be posted online if you'd like to review anything.